if I can keep going. Let me see if I can keep moving, and if that makes it worse, or if that makes it better, or if it just stays the same. Right? So that's number 2. In my case, it went away. Like, I was able to keep running and it didn't hurt. Now, if it had continued to hurt and it continued to bother me and it got worse and it was really swollen and all gnarly the next day, then I would give it a couple days, right? If I literally couldn't walk, if I could not walk and I couldn't put weight through it, that is a different story. So that might require an x-ray or something like that. But even then, I typically will give it a couple days. I like to use time as a gauge. And usually it's within the realm of a day, 2 days, a week, depending on the severity. And usually, like, if pain levels get to such an extent, or like you can't walk on it for a week, like when I say you can't walk on it, you actually can't put weight through it, right? You actually need to be on crutches. Like, it has to be to that level for me to elevate it or escalate it to the next level. Yeah. Does that make sense? Okay. Yeah. Is that clear enough? Okay. Cool. Anything else? Anybody in the back here? Yeah. Okay. Cool. If something does come up, just either write it down or let me know. I think we still got time. I'm going to go back to this slide. Okay. We talked about how Sam had an MRI, right? So this is another checklist that's also important that I go through, and that would be really, I'm going to send this checklist to you guys too, just kind of a back pain checklist. But this is mesmerizing. Wow. Okay. But what should happen, or let me go through what shouldn't happen. Okay. So give me that pen. Can you throw me that pen? Oh, I can't catch anymore. I know. I would catch with my right since I'm a lefty, so you know it's. Maybe that should help. It's very specific. Yeah. Okay. So if I have if this pen is on the ground, and I pick it up, and now I can't bend over anymore because I just totally tweaked my back out, right? Isn't it the most innocuous things that often do these things? Right? It's like, I shouldn't. Yeah. Mopping or sweeping. Yeah, like that. Yeah. Yep. So that type of stuff, right? And then, you know, you do these really simple things. You're like, why is this an issue? Like, come on. And then you're like, okay, well, it hurts enough. Let me go see the doctor, right? Fair assessment, right? It's normal. Like, that's what most people do. And then they go, and they're maybe there for 10 minutes. A detailed history was not taken. There was no clinical exam. And what I mean by clinical exam is if somebody has back pain, and I'm just going to use that example. This would happen for every different type of injury, though, whether it's a knee or a hip or a neck or whatnot. There should be a movement exam component of it, right? So if somebody has back pain, I'm going to ask them to bend forward. Right? I'm going to ask them to bend backwards. I'm going to ask them to rotate. I'm going to ask them to do all of these things. And I'm going to ask them, well, what did you do? Like, what did you do? Oh, I picked up a pen off the ground. I'm like, okay, well, yeah, like that you might have really tremendous pain right now, and it might be just killing you, but that is not a fire, right? That is not a fire. But too often that is treated like a fire, and then gets just completely escalated, and now you've got an MRI. All right, so let's talk about the MRI. A lot of people demand getting an MRI or demand getting an X-ray. So it's not to say that doctors are just handing these out like candy, right? Some of them are. But a lot of people demand it too because they think that by seeing what is wrong with the tissue, that they will now know the issue. Tissue issue. It's a rhyme. Yeah. Come on, guys. You got to give me more than that. So they think that they can find whatever the issue is by looking at this image. The problem with that is that we have large studies to show that that's not accurate. That's just simply not accurate. If you have an MRI and it shows that you have a disc bulge and you have back pain, it's like, okay. If you're 60 years old, there's 85% of the population who's going to have a disc bulge and have no pain, right? There's lots of people who have lots of things on imaging that have no pain, right? So we can't say, if there is no clinical exam and it doesn't match with what's on the MRI, we can't say that that's what's happening. We can't say that that's the cause of the pain. It's a scapegoat. It's like, oh, well, here you go. This is clearly what it is. I have people every day who come in, and an example, I was working with this woman 2 years ago, and she had an MRI done on both knees. I don't know why on both knees, but she had it done on both knees. And she was having right knee pain. Okay. Imaging came back, and she comes in, she's like, Nathan, this is so strange. I don't understand this. Can you explain this to me? I've got a small meniscal tear on my right side, and it hurt, like my knee hurts like hell. On my left side, I've got 2 large meniscal tears and severe osteoarthritis, and I have no pain. I have no pain in this knee, right? So she's got this little, like a little paper cut on this knee, essentially, and like somebody just took a mallet to this leg, but this is the one that hurts, right? I see that all the time, and it's super counterintuitive. You would think that what you see is what you get, because that's what life is in many cases, but really, if you look at the literature and like the people that I've worked with, this just is a repeating thing over and over and over and over again. So when one of the boxing instructors here told me that she had a torn meniscus in her knee, I was like, okay, well, guess what? The best thing for that is to exercise. The best thing is to be active and keep going. Now, in some cases, of course, the MRI does match clinical symptoms, right? And that's a case where if you go through conservative care and it's been several months and you're not getting better, then yeah, you can elevate it to the next level. So I'm not anti-surgery by any means. I'm anti-unnecessary surgery. That's all I am. I want people to go through the correct levels of care so that they don't have these bad outcomes. Because I've seen plenty of people who have had a surgical procedure done and then had a horrible outcome. And then they tell me, I wish I wouldn't have gotten that surgery, right? Again, that's not to say that surgery is not indicated, and if you do match the criteria for surgery and you go through the proper steps, you're probably gonna have a really good outcome. But that's my take on MRIs. Yeah. Any questions on that? Any experiences?
With my MRI, it didn't show my herniated disc. But I had had such bad pain for so long. When I hadn't had the surgery, they took out some bone spurs, and there they found a completely ruptured. Just that been for a long time, started to come out nice, and the sciatica was right in the middle.
Yeah.
But it never showed on that side.
Yeah.
Other bulge discs good on the other side that doesn't hurt.
Right.
But the big culprit was not even diagnosed on that one.
Yeah. And did you have clinical symptoms too, like going down the leg, and it matched up? Yeah. So you were a proper candidate for a surgical procedure. Yeah, absolutely. It was good. Yeah. Yeah. You went through the proper course. It was successful, and that's how it should be, right? Like surgery can be amazing. It can, like total joint replacements, like amazing. People go back to almost like they go back to hiking, they're playing tennis, all of these things. It's just when things are done and out of order, that's when you get a big problem. Yeah. I don't know if do we have any more questions? I got time. Well, I go with 2 minutes. Well, thank you all so much for being here. I really appreciate your time. I really appreciate your time. And let's see, so if you haven't put your name and email down there, please do. I'm going to send a bunch of resources to you. There's going to be a bunch of videos that dive deeper into pain. There's going to be a lot of videos that dive deeper into exercise, and I'll continually update that. Oh, yes, thank you. If you want to be in a group photo, if you wouldn't mind, we have a photographer here. If not, you can step out. You don't have to be. I won't be offended, don't worry. I've been offended enough in my life to not be offended anymore, so.